to solve a pretty intense medical mystery. It's called Pemphigus Vulgaris. And to do it, we're going to follow the incredible story of one patient's journey from these just debilitating symptoms to finally getting a diagnosis and starting down the road to recovery. So, let's dive in.
So our story starts with Mr. Vora. He's a 28-year-old man, and for over a year, his body started sending out these major distress signals. The signals just kept getting louder and louder, but what was causing them? Well, that was a complete puzzle.
I mean, just try to put yourself in his shoes for a second. For a year and a half, every single time you swallow, it's painful. You have this constant severe itch that you just can't get rid of. You've lost a ton of weight. We're talking 10 to 15 kilos, and you just feel weak all the time. This isn't just a list of symptoms. This is someone's life grinding to a halt.
And then, during a physical exam, doctors found a really fascinating clue. Right there on his fingertips, these deep, horizontal grooves on his nails. They're called Bowes lines. You can think of them like the rings on a tree, each line marking a period of intense physical stress or a major illness. His body was literally recording its own trauma. And this is what that trauma looked like on the surface. For a full 18 months, he was dealing with these painful, crusting lesions all over his body, even on his scalp. He'd been to multiple doctors, he'd tried oral steroids, but nothing worked. It was only getting worse. So what on earth was going on here? Well, the answer wasn't some external invader, like a virus or a bacteria. No, this was a case of the body turning on itself. It was a true civil war happening at a microscopic level.
The name of the condition is Pemphigus vulgaris, and it's a rare, pretty serious autoimmune disease. Basically, your body's own defense system, your immune system, gets totally confused. It's like its friend or foe recognition system goes haywire, and it starts launching this massive attack on its own perfectly healthy skin.
Okay, here's a really simple way to picture what's happening. Think of your skin cells like they're bricks in a wall. The stuff holding them all together, the mortar, is a protein called desmoglein. Well, in Pemphigus vulgaris, the immune system's soldiers, these things called autoantibodies, they mistake that mortar for an enemy and just start attacking it. And when that glue gets destroyed, what happens? The bricks, the skin cells, they just fall apart. This whole process has a medical name. It's called acantholysis. And that is what causes the skin cells to separate and form those incredibly fragile, painful blisters that we saw all over Mr. Vora. It's just a brutal example of how a tiny failure on a microscopic level leads to huge, visible suffering. Now, you might be thinking you've never heard of this disease, and that makes sense. It's very rare overall. We're talking maybe 1 to 5 people per million worldwide. But it's not totally random. We see it more often in people of Middle Eastern, Mediterranean, and South Asian descent, which really points to some kind of genetic link.
All right, so now we know what the disease is. Let's get back to the hospital and see how the clinicians basically acted like detectives, piecing all of these clues together to finally crack Mr. Vora's case.
So, the diagnostic journey here is really a three-pronged approach. First, you start with what you can see with your own eyes, the clinical presentation, right? The blisters, the sores in the mouth. Next, you go a little deeper. You take a skin biopsy to actually look for that cell separation, the acantholysis under a microscope. And finally, you run specific blood tests to find those culprit autoantibodies. And that's what seals the deal and confirms the diagnosis. One of the biggest first clues came from Mr. Vora's blood work. His C-reactive protein, or CRP, which is a key marker for inflammation in the body, well, it was through the roof. A normal level is less than 10. His was 106.1. That's not just a red flag. That is a blaring 5-alarm fire alarm, signaling a massive inflammatory response happening inside him. The next clue? His neutrophil count. Neutrophils are a type of white blood cell, basically the immune system's first responders to an infection. A normal count is somewhere between 30 and 70%. His was 83%. This told doctors that, on top of everything else, a nasty secondary bacterial infection had set up shop in his broken skin. A swab later confirmed it was MRSA. And with that, all the pieces just fell right into place. The patient's story, the physical signs, the lab results, it all pointed to one single conclusion. The puzzle was solved. Mr. Vora was diagnosed with Pemphigus vulgaris, affecting his skin, his scalp, and the inside of his mouth. So, the diagnosis is in. The enemy has been identified. Now, it was time to draw up the battle plan and assemble a serious medical arsenal to fight back against this disease on multiple fronts.
You see, the strategy isn't just to stop the disease in its tracks, it's more like a military campaign with different phases. First, there's the induction phase. That's where you hit it hard with high-dose firepower to get things under control. Then you move to the tapering phase, where you gradually reduce the intensity. And finally, there's the maintenance phase, where you use ongoing therapy to stand guard and prevent a relapse.
So let's break down that arsenal. It's a really smart, multi-layered approach. You've got corticosteroids, like dexamethasone. Think of these as the heavy artillery to just crush that inflammation. Then you have immunosuppressants, like azathioprine, which target the root of the problem, that confused immune system. Of course, you need antibiotics for that secondary infection, and then a bunch of supportive meds to manage all the other symptoms and side effects. It's a truly comprehensive attack.
But getting a diagnosis and a treatment plan, that's really just the beginning of the story. The final and arguably most important part of this journey is all about learning to live with a chronic condition, day in and day out.
And one of the very first things you have to address is fear and misunderstanding. I mean, when people see severe skin conditions, they often worry if they can catch it. So let's be crystal clear here. Pemphigus vulgaris is not contagious. You cannot catch it from someone, and you can't give it to someone else, period.
Managing this disease goes way beyond just taking pills. It's about making smart adaptations to your life. Gentle skincare is absolutely critical to avoid any friction that could trigger new blisters. For the painful sores in the mouth, a soft, non-spicy diet is a must, and, a big one, managing stress is crucial, because stress can be a huge trigger for autoimmune flare-ups.
And finally, the medication itself. This is where the patient has to become a true partner in their own healthcare. Little instructions can make a world of difference. Things like taking certain meds with food to avoid an upset stomach, or taking an antihistamine at night so you're not drowsy all day. And some are life or death important. Understanding why you can never, ever just stop taking steroids suddenly, or why you have to finish every single antibiotic. Following these rules is everything.
So Mr. Vora's story really shows us the full arc, from mystery and intense pain to finally getting understanding and a plan for management. It's such a powerful reminder that sometimes the fiercest battles we face are the ones being fought inside our own bodies. And it really leaves us with a question, doesn't it? How can stories like this one change the way we think about the complex and often invisible diseases that people are living with every single day?